Good morning. My name is Erin Colburn, and I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. It's a great pleasure to reintroduce Jennifer Steinbrunz from ISU, Idaho State University in Pocatello for their dental hygiene program, their Bachelor of Science in Dental Hygiene. And what we're going to hope to do today is get to know this program a little bit better. I'm going to go ahead and turn the time over to you, Jennifer.
Thank you very much, Erin. Thank you for joining us today. Before we get started, I wanted to introduce our distinguished guests. We have two representatives from our department here. We have Mackenzie Boynton and Veronica Smith. They are two soon-to-be graduates of our department. I appreciate them taking time out of their busy day to join us today. And then we also have Yaritza Barrera. Yaritza Barrera is an amazing advisor that works in our pre-health program, pre-health office over at ISU. So she is our other great resource for questions about dental hygiene. So it's possible that some of you from Boise State that are interested in this will be working with Yaritza as well as myself. So thank you very much for inviting us to join you today. We're more than happy to speak about our program. Right here on the screen, we have a beautiful picture of our building. We are located on the Pocatello campus. As you may know, ISU does have multiple campuses, but we are located on the main campus in Pocatello. So we're going to talk a little bit about the program and what is involved. So about us, we are proud to be the only dental hygiene program in the entire state of Idaho that offers a Bachelor of Science degree in dental hygiene. Now, you don't need a Bachelor of Science to get a license, but what the Bachelor of Science does is it gives you more opportunities, more experience, because you're not only learning about being a dental hygienist, you're learning about being part of the whole healthcare team. And that's what this degree can give you. Our program has been active for over 50 years. The first Idaho State University dental hygiene class graduated in 1963. And our graduates are educated to work in a variety of settings, from private practice to public health. So in terms of what the workforce looks like for dental hygienists right now, the need is growing. According to statistics on the Bureau that I looked up, pardon me, employment of dental hygienists is projected to grow 11% from 2020 to 2030, faster than average for all applications. And I think with the pandemic, it's put this into greater focus because of how much of a role these dental hygiene professionals play in the overall health of the patients that come through the clinic. So what does a dental hygienist do? A dental hygienist does many, many things. Now, before I list this, I should provide the caveat. I am not a dental hygienist myself. My background actually comes from English and rhetoric. So the joke I always make to applicants is that about a month in, when students start talking about things I don't understand anymore, that's how I know that they're learning and they're progressing through. And so that's why I'm pleased to have two of our students available here to provide their insight into what the program is actually like. But to go back on what a dental hygienist actually does, some of the things that you're going to do are oral evaluations, regular and deep cleanings, x-rays, fillings, sealants and fluoride, teeth whitening, and education on good oral hygiene practices. From what I've heard from my own experiences with dental hygienists, they have the most contact with who is in the chair. So they have a chance to create that bond and help set good health habits and play an integral part in that patient's experience. So here in this picture, we have a demonstration of nitrous oxide. You can see the nasal hood, and we have some of our alumni showing, and this is actually one of our now alumni showing off in our clinic. Very proud of them. This is the outside of our clinic. I actually have a link available to our virtual tour. I'm going to bring it up for us. Now, the dental hygiene clinic is featured in here. This does not feature, however, our brand new renovation that was provided by Delta Dental. We're very grateful for their wonderful gift. We're actually going to be celebrating that by doing a clinic dedication on Friday, April 15th, and the public is invited. That will be on the Pocatello campus at 12:30 p.m. But I'm going to go ahead and launch the tour for you to show you. This is a great tool if you want to get a general idea of what the campus looks like, but you don't want to commit to coming to Pocatello just yet, and just get a general idea of what it's like. So let me just move this screen over because I don't want to register us quite yet. Now, if you're interested in accessing this tour at a later date, this link is on ISU's main page. So here we have Swanson Arch. This is one of the iconic pieces of campus. I'm going to skip the intro. that our new students, when they
see it
come
on
into
the screen.
campus. Oh, sorry.
It's not on the screen. We're still seeing the building from your PowerPoint.
Oh, sorry. Let me try that differently. I think what it's doing, I'm going to unshare and reshare. Pardon me. Classic Zoom stuff. I forget. There we go.
No worries.
This should fix it. Can we now see the lovely globe going back and forth? Okay. Let's see if it works. Sometimes this isn't great on Zoom. So if it's not, we'll move on. If it decides to load, that is. All right. Because I don't want to take up too much of our time on this, but I'd like to show you the clinic if we can get it to load. All right, we'll just skip ahead to the clinic portion. All right. Okay, here we go. So we have, this is one of our wings of the dental hygiene clinic. So it just shows you a general idea of what one of the wings looks like. Now, again, there have been some updates made. We do have brand new chairs, new flooring in there. We've had, you know, the gift from Delta Dental was substantial. We appreciate their support. But this gives you a general idea of what a typical unit is going to look like. And Mackenzie and Veronica can speak more to this because they're the ones that are in there right now going with that experience. But this gives you an idea of the facilities without having to come on campus right away for a visit. We're very fortunate to have the clinic right next door to our main department building, so you do not have to go off-site for your main clinical experiences. You will get experiences off-site working in the community, but we do have our clinic right on site. So we're going to go back to our presentation here. So now you've seen a small snapshot, pardon me, of the clinic. Pardon me for just a second as I take a drink of water. Now I'd like to talk a little bit about what does it take to get into our program. The main thing, number one, is that you must meet with the Department of Dental Hygiene advisor at least once before applying. So, you know, your read stay is absolutely fantastic. She can help a lot with that. When we're talking about our department advisors, we're talking about me and my staff role. So I am an administrative assistant in the department, and I do help with advising, and then our faculty do as well. So you would contact me, and my contact information is at the conclusion of this presentation. So I'll provide that to you. We need you to meet with us at least once before applying. I'm offering appointments via Zoom and over the phone right now. I will resume in-person appointments at some point, but I'm doing mainly Zoom at this time. In terms of the actual requirements, you must have 6 or fewer prerequisite and or general education objectives left to complete by the time that you apply. Now, our deadline, no matter the year that you apply, is January 15th. It's pretty set in stone. So our prerequisites are listed on our dental hygiene website, which is isu.edu/dental hygiene/Bachelor of Science. Depending on what kind of questions we have at the end of the presentation, I am happy to pull that up and show you where that is. But we have a certain set of prerequisites that can be done at Boise State if you prefer. There is one prereq that can be done only at ISU, that is Dent 2201, but we offer that online over the summer because it does not need to be completed before you apply. We offer that online over the summer with ISU over 4 weeks. You can take it then, or if you choose, you can get it done before you start, before you apply, but it's up to you. The big thing that we see, the number one thing that I see that is really, really important with admissions is this part here. You must have at least 4 of the 6 required science courses done by the end of the semester before you apply. So most often for many applicants, that's the fall semester. This besides GPA is what tends to disqualify people because they're not quite there yet. So that is why it is so important to meet with the dental hygiene advisor at least once, if not twice, before applying so that you know that you're good to go. So the 6 sciences that we require are human anatomy and physiology, 1 and 2, chemistry, organic and biochemistry, microbiology, and nutrition. There is a BSU equivalent for every single one of those sciences available at your school that will work for us, that will transfer. So you don't need to worry about planning for that either at ISU or another school. And then finally, a minimum GPA of 2.8 in the prerequisites and the science courses is required to be considered as a qualified applicant. Now, what we mean by qualified is we will consider you for admission, period. That does not mean you're going to get a seat automatically. We only have 32 spots in the program. So in order to be really competitive, I recommend shooting for a GPA between 3.4 and 3.6 in the prerequisites and the sciences. In terms of letter grades, that means all A's and B's in those classes with more A's than B's. That doesn't mean that one C will derail you. But if I have an applicant that has all B's and a few C's, that's often not competitive enough to get into the top 32. And since I'm also, I get the chance to be one of the first reviewers in the application process, that's what I've noticed in the 8 years that I've been doing this as a pattern. And I find sharing that information is a lot easier to understand than talking about the GPA. Because one of the main misconceptions that we have with the GPA is we are only looking at the GPA in our prereqs. So if a student like from BSU decided to come to ISU, but not have an associate's degree ahead of time, I don't know if I mentioned this yet, but if you have an Associate of Arts or Associate of Science or higher degree, either before you transfer to ISU or before you would start our program, then you do not need to do our general education objectives. That is the path I recommend for transfer students. It just saves you a lot of time. But even if you do the gen eds, we don't look at the grades for the gen ed objectives. We look at the grades for the prerequisites. So there are some objective courses that also are prerequisites of ours. And actually, the more I'm thinking about it, I'm actually going to stop our presentation for a second and I'm going to bring up those prerequisites because I feel that that would be a useful tool for us to look at. So I've unshared, I'm going to bring that up and we will continue our conversation in just a moment. I apologize for not having that pulled up in advance. I'm going to go ahead and reshare so that you can see where you would go to find this information. So you're going to go to isu.edu/dental hygiene first. We have our main page. You would go to Bachelor of Science. And then under admission cost and requirements, this is where you can find our prerequisite information. This is where we're going to be putting our information about admissions. This is where you would also go to apply for our dental hygiene program when you are ready. So the actual core courses that we require are here on this second page. It's this group here. And then the general education objectives that we're referencing, this is what I'm talking about here. Now, some of you may already be familiar with this information, so this might be a refresh for you, but just to reiterate, the electives that are listed here, they are not required. They are simply there if you, pardon me, if you need extra classes to fill out your schedule and you're looking for stuff that might work alongside, the dental hygiene subject matter, these classes will work well for that. But again, they are not required. And I've had some confusion with that from applicants, so I wanted to just make that clear. But it's these courses here that we're looking at the grades for specifically. All right, let's go back. So now I would like to turn it over to our student guests, Veronica Smith and Mackenzie Boynton, to go ahead and share a little bit about their experience. What I'm going to do now is I'm going to go ahead and unshare my screen to give them an opportunity to speak. So thank you, ladies, for joining us today. Please go ahead.
Hi, I'm Veronica Smith. I'm a non-traditional college student. So when I decided to go back to school, I chose ISU because I was in the dental field previously for about 10 years, and I had seen applications for dental hygienists that didn't have a bachelor's of science get thrown away or shredded without even a phone call. So I had seen that it was preferred out in the workforce. And it actually took me 2 years to get accepted into the program. My first year, I didn't get in, and I was expecting that. And it was more with my credits being old, but that doesn't matter. But I got in my second year, and it's been a challenge. Not gonna lie, every day is a gauntlet. It's a difficult program, but I know that they've given me the tools to go out and make the choices every day in my career that help advance the profession as a whole and that are the best for whole patient care. I know that if I wanted to go out and change the world of dental hygiene, I have the tools and resources to do that. And I know how to make things happen. But even if I don't, I know with this education and training that I will practice at the top of my licensure. And I have all of the experience, I guess. And I've had all of the experiences, especially with the external rotations that ISU's program offers you, working with the Pocatello Free Clinic and working with long-term care facilities and telehealth. I know I'm prepared. So I hope that's helpful.
Hi, I'm Mackenzie. I am more of a traditional student, so I am from Boise originally, and I moved up here to ISU, and I have gone here all 4 years. I applied my second year here at ISU after I got all my prerequisites done, and I was accepted the first time. I chose ISU originally because I knew I wanted to go into dental hygiene, and I knew it was going to be the right fit for me to start here and stay here. But a lot of our classmates have not done that. A lot of them have transferred from other places, and they've been just as successful as myself and the students that started here at ISU. And the program is built for anyone to come and learn, which is really amazing. And just like Veronica said, I think the reason I chose it like as one of my highest schools was because we do get a bachelor's degree. That is extremely important. And as our field is progressing, we might see it be the entry-level degree in a few years. We don't know for sure, but to have that under our belt is really important. ISU is also unique in the restorative aspect. So we learn how to place fillings, both the white composite and the silver amalgam, which a lot of programs don't learn, which is just another thing that we have a knowledge about that a lot of other dental hygienists don't. And so that is to our advantage in understanding what the doctors that we're working with are doing as well. And like Veronica said, I echo, it is a hard program. It is pretty intensive, but it's been worth every step. We are a very close-knit community here at ISU, and the people that you meet in the program support you throughout the whole thing. I've never felt alone because you make these friends that you might not know that you were going to make until you got here. And you have an amazing support system, both in the ISU community itself, but also within your class. And so I'd encourage that if you really want to come and be a dental hygienist, this is the place to be.
Thank you very much, Mackenzie and Veronica, for sharing that very important information. Just to highlight what they're saying, you know, we're so proud of what their classes achieved, and these two specifically. You know, these students entered the program in the middle of the pandemic, and they've managed to make it work, you know, and I want to applaud them. You know, like all the programs, we had to make some adjustments and there have been challenges, but they still have been successful in getting their degree. And then we have, you know, it's wonderful to see students, for instance, like Veronica, come in who have that career experience and are providing that insight. And one of the things I love about what I get to do is I had a chance to speak with both of these students at the beginning of this process, and watching them transform from those first meetings all the way through to where they're getting ready to graduate. And I'm very proud of them. So ladies, thank you for your time. Thank you for taking time out of your busy schedules to meet with us today. Congratulations on finishing up your requirements. If you need help with your licensure stuff, I am a notary and can help you get everything stamped and ready to go. And we are extremely proud of you and your accomplishments. Thank you for choosing us to get your education at. And so something else I want to highlight is that we are a family. You know, the students, it is a gauntlet. You will work hard. From what I've heard from the students, and Mackenzie and Veronica, you can correct me if I'm wrong. I have heard that often the very first semester is one of the most rigorous because you're being given all of this new stuff. You factor in for them, they were dealing with a curriculum where they were mainly over Zoom because of the needs. You know, the pandemic was very fresh at that point, and they made it work, but they've had a more unique experience. And so they've had more opportunity in this last year to go out and do more rotations, and it's hopefully been a little bit easier this spring, but they've had to make it work. But then they're able to show employers, look, I went through, I got my education, I'm ready to go. I know how to make it work. I know how to be safe. I know how to make my patients feel safe. What do you need? And it's quite common for our alums to get job offers very quickly. I'm getting a lot of emails from offices saying, we need you, we need applicants. Will you please let your alumni know that we are hiring? All over. A lot of people from Wyoming, Montana. So the jobs are out there. So does anybody have any questions for our guests before we move on?
Tell us why dental hygiene. Why did you want, Mackenzie, you said, I always want to be a dental hygienist. Why? Why do you want to be a dental hygienist?
That's a really good question. And it's a question that we get asked a lot actually in this program when we're going out on rotations and things. One of our rotations is to elementary schoolers. And so that's their favorite question. For a long time, I know it's like kind of the generic answer. I knew I wanted to help people. I knew I wanted to be in healthcare somehow and help others where I could. I wanted to do something. But I also like smiling, and having that smile has been, I think I've learned a lot over the last 2 years with wearing masks is so important. And when you come into dental hygiene, you think that you're going to see all these people with beautiful smiles every day, or you might not. And when you start talking to people one-on-one, like knowing that their smile is like the number one thing that they know about themselves. I've had patient after patient say, oh, I hate to smile. Like, what can we do to fix my smile? What can I do to make my face look better? And so dental hygiene has just allowed me to help people that need help that we don't always think about. And I think the other amazing thing is, I remember when I was little, I wanted to be an elementary school teacher. I wanted to teach, I wanted to educate. And dental hygiene allows you to do that. Every single day you have someone in your chair, you're providing education about what's happening, whether it's systemic conditions, whether it's their oral conditions, whether it's their habits. And so it really just allows you to practice so many different skill sets. And I get to meet different people every single day, which is such a cool opportunity. That's why I picked up dental hygiene.
Okay. Veronica.
A lot of the similar reasons or huge benefits about being in dentistry. People like their smile to look nice and it makes them feel good. Sorry, I'm on my phone and it just went off. But to me, I think having been in dentistry for a while now, the reason I'm still passionate about dentistry and wanted to advance my degree to dental hygiene is because people don't realize how closely connected the oral health is with overall health. And it surprises people. The lack of public and common education about oral health and oral hygiene is low. It's not very common, and people are always shocked with the information that we have for them. So for me, being able to share that passion and get other people excited is the best part. And I think every day, at least a few times a day, we hear, oh, how come nobody ever told me this stuff before? How come nobody ever educated me? How come nobody taught me how to do this right? Or what's important with oral health, or how it's connected with my blood sugar and inflammation in my body. So it's really neat to be able to be a part of that process as well.
It's funny that Veronica mentions blood sugar. I'm actually a type 1 insulin dependent diabetic. And when I started this program as an employee, I had a bad diet soda habit. And I've dropped it, switched to water, and my oral health has improved. And it's been interesting to see those relationships. And a number of years ago, I had an opportunity to present. You take a class in medical emergencies in your first semester of the program. And I have presented in that class before on my experience as a type 1 insulin pump wearing diabetic and how my oral health has gotten better as my insulin control has increased. And that's what's cool, is that ISU is also well known for our major focus on health sciences. And so, you know, there are interprofessional opportunities that are often available to the students so that you're able to see yourself as a huge part of a big healthcare team. And, you know, for instance, Yuritsa, in the role that she plays, you know, she helps our department especially, and she works with many other departments all throughout the health sciences. And she's been a wonderful representative for us at many events. And thank you, Yuritsa, for that. She represented us at the recent ISU Meridian Health Sciences Experience Night. And so, you know, she's a great face for our program as well. And she's able to, you know, even see at that beginner stage how those pieces connect. So as another example, I have seen many of our alumni get their bachelor's degree in dental hygiene and then choose to go on to dentistry. You know, and theoretically, somebody could go on to medical school with this as well, because you're getting that bachelor's degree. It's a base degree. And even if you have an applicant, an alum that decides not to practice, you take classes in ethics, you take classes in leadership, you take classes in interprofessional opportunities and research. So you do projects, you create posters, you write a lot of papers. So you're getting a whole experience in being a well-educated member of this community. Furthermore, I did just want to provide a quick little shout out. We also provide a fully online master's degree program in dental hygiene for those that might be interested. And so what's nice about that is that you don't need to be in Pocatello to do that program. You could be in Europe doing that program and you still pay in-state tuition, to my knowledge. And you are being taught by top people in their field in dental hygiene. Many of our top faculty are alums of this program. And so if you're interested about that, I'm more than happy to provide contact information for that as well. But it's not common for our students to go directly from the bachelor's to the master's. We are exploring, and I believe have an active pilot. We have an active pilot program right now between our bachelor's and master's, where students, if they can get it, and Veronica, please feel free to provide some clarification if I mess this up here. Veronica has been actively involved in that partnership program with us. Thank you. That when you can get accepted to the master's program and start taking some master's classes in your senior year in the program. We're still trying to figure out when and how many, but to help bridge that over. So if you're interested in that, please let us know. But what I can say is that you don't need to, I'm sorry, go ahead.
No, go.
So Veronica, did you want to add anything? Because I oversimplified it, but you know.
No, you hit the nail on the head, Jennifer. I think it's perfect what you said. I'm the first student to do it, but I think that there's another student right behind me doing it. And we're just I take the 400 level course, like the leadership course, and also the 600 level leadership course at the same time. And the 600 level course for the master's program is online. So it's tedious in that sense, but I think if I'm doing it, I'm a full-time student already. It's worth it. I'm going to have 3 master's classes already done and under my belt by the time I graduate in 3 weeks. So definitely worth looking into.
Yes, and we thank Veronica for volunteering to be our test subject on that. So Shannon, looks like you had a question. Please go ahead.
So what is the benefit of getting a master's degree in this? Does it pay more, or Yeah, can you tell me what the benefits are?
Sure. Now I will speak. Now quick caveat. I have a Master of Arts, so mine's different. But from what I've heard, it offers more opportunities in that if you have somebody that would like to teach at the college level and be in we call tenure track, you do want to have in order to advance with that terminal degree. Right now in dental hygiene, the terminal degree is the master's. There is not. I mean, there's been some exploration of a PhD in dental hygiene, but not. And the nice thing about being a faculty in colleges is that you have a lot of job security and your chance to be actively involved in educating the next generation of dental hygienists. And then our students get direct experience in doing research and things like that. So many of our graduates from the master's programs have had major roles, leadership roles in some of our major national dental hygienist associations. I believe one of our alums was the most recent president, of one of the major associations, and I can't remember the name off the top of my head. So you get getting trained by the experts who have a lot. So you write a thesis at the conclusion of your master's program, and you are supported by people that are at the top of their field. So for instance, one of our faculty members who teaches both in the bachelor's and the master's program, her name is Dr. Ellen Rogo. She has been recently nominated as one of the 2022 outstanding researchers for our university. Congratulations to her. And so she has written book chapters. She's very active in publishing. She just got back from ADEA in Philadelphia presenting on her work. And so she's teaching. And so she is actively contributing to the profession, and being a shaper with that. And so it offers you more opportunity. And the nice thing about it is because the way that it's paced, you can work, and it's designed for you to do the program while you're working. In terms of pay, I don't have particular numbers in front of me right now. I think it mainly opens up more opportunities for people to look into for careers and subsequent raises from there. Because, for many of our alumni, career in private practice is fantastic. They're happy with that. That's what they want to do. And I can't speak to all the experiences, but then we have some that are like, you know what, I would like to contribute in a different way. And this offers more opportunities in that.
Awesome. Thank you.
If you don't mind, I'll just quickly add to that.
Please
Jennifer.
do.
That was really awesome description. But just a little education as to why it would be beneficial to get the higher level education in dental hygiene instead of stopping at a bachelor's of science is more, I think, geared toward the advancement of the profession as a whole. Dental hygiene is a fairly young profession. It's only about 100 years old. And they call nursing our sister profession. And I think that nurses, we're probably 10, 15 years behind nursing as far as advancing degrees and becoming a true profession in our own right, which means that you could self-regulate, right? And that there is a terminal degree like a PhD or doctorate in dental hygiene. So the more people that get more advanced degrees are available to teach and design and do the research and be a part of the advancement of dental hygiene, like we have seen nursing advance, because you didn't used to need your bachelor's in nursing, and now hospitals prefer if you do. And then nurses can also advance their careers and become diagnosticians and have prescriptive authority with nurse practitioners, right? Or PAs, or there's other ways to become a high level practitioner than just going to med school. So I would like to be a part of seeing that change, even if it is just one more person that has a higher degree. And the Master's of Science is important because, like Jennifer said, that means you went through the gauntlet of proposing a thesis and getting approved and getting published. And that's different than any other master's degree that is not a Master's of Science, I believe. So those are a couple benefits that drew me into the program and helped me want to take an extra class on top of the already big load.
Thank you, Veronica. That is very, very helpful. But like, for instance, as an example, you know, if you want, like, let's say you have a passion for heading up a dental hygiene program. For a lot of these ads, like we recently, you know, we have a relatively new dental hygiene department chair. His name is Ryan Clough. We're very excited to have him. He's a great asset to our department. You know, but with those ads, one of the big things is like a minimum qualification, master's degree. That's like the top thing. So that's what it is. So if you want to advance, that's what you need. Do we have any
Do
questions?
any of the students have any questions about the dental hygiene program?
Yeah, I have one, if it's okay.
Please go ahead.
I've just been writing notes the whole time you've been talking. So when we were talking about GPA requirements, prereqs, I was wondering if that 3.4 to 3.6, was that recommended for the GPA in science courses only, or was that the whole list of prereqs that you had on the website? You know what I'm talking about?
That is a fantastic question. Thank you for asking that question. So I would say, now that's a number that I came up with just from my experience. So it's not an official published number. It's more, it's the line that I give when I advise. So I'm saying overall, because we're looking at the core GPA, we count all of those non-science courses. So let me bring those back up again.
Yeah, that'd be great. Thank you.
Let me reshare. Hold up. Certainly. So core GPA is all of these courses here. So we're counting the sciences in there in the core GPA. And when we're right now in our current setup, when we're looking at admissions, the core GPA here is worth 35 points of the admission score. And the science is worth 40. So ideally, the most successful applicants that I see have similar GPAs high between both. So I would recommend you want to aim for that kind of GPA in both, but it's really important in the sciences. And then one of the services that I can offer you is I encourage you, if you have questions or you want to see how your courses transfer. While I am not an official transcript evaluator, I have tools that I use and are actually available to the public that allow me to see how your courses would transfer. And if you have enough courses done, I can help you calculate your GPA right now so that you know where you stand, so that you can feel confident and say, okay, this is where I'm at right now. If I want to be here, this is the kind of grades that I should be earning. Because one of the common questions I get is, okay, should I be repeating courses? So we allow up to 3 repeats of these courses here with no penalty on the application. Now, if a student has repeated one of a different course, like for instance, let's say a student just took physics and repeated it. For us, that doesn't matter because it's not one of our requirements. So I sometimes have students that will say, well, I got a C, I should go ahead and repeat, right? And it's like, not necessarily. We need to look at the overall picture. And the way that ISU looks at repeats, we accept the most recent grade, even if the most recent grade is lower than the original grade. Just the thing to keep in mind. Now, something else I just wanted to let you guys know as well, the way that we also look at repeats. So let's say you were to take Human Anatomy Phys 1 at BSU, but then decide you didn't like the grades, so you decided to retake it at ISU. Even if that BSU course transfers exactly equivalent to ISU's Bio 2227 and 2227 lab, our department won't count that as a repeat because it's 2 different courses from 2 different schools. So that's nice for transfer students. It gives you a little bit more, you're hopefully not penalized by that a little bit, because we don't want to penalize those that have repeated in the pursuit of better grades, especially since a lot of students have long stories. maybe they've gone in a totally different direction for years and then they've switched gears. So that's why we've made it 3 repeats. And then even if you get to 4, you're not losing a ton of points on the application, but it's a relatively generous policy. Does that answer your question, or did I kind of go off in a different direction?
No, that was great. This is all good info to know. And then I've kind of looked on the website on, I think you guys have like a point system. Well, like you were
Yes.
talking about, I looked at all of that before. So I know what you were talking about when you said the course overall
Mhm.
GPA 35 points, science 40. Is there anything else that you guys award points for, or is it purely just based on GPA?
Great
For
question.
example, some other classes or some other programs give points if you're a dental assistant before, etc.
Great question, and thank you for asking. So what she's referencing, I'm pulling up an example of the admissions rating form that we use. So this is available on our website on the back page of the 2021-2022 admissions information. Once we get into the new year, new academic year, we will update this once again. So no, we don't offer any bonus points if people have dental assisting experience. We do not require any shadowing. We don't require an interview. We have an optional personal statement that you can do, but we are currently not requiring it, and we're not putting that into the grading. If we were going to do that, we would make it very clear ahead of time. It would be something that we would have to clearly advertise, because, you know, so this is my 8th year doing admissions, and it's always been academically based. But this is pretty much exact copy of the back page of the admissions rating form. So what I was speaking to, the repeated courses, this is what we're talking about down here. Now, there are 2 opportunities for bonus points that don't necessarily, like, they're not going to take somebody from, let's say, our alternate list, our wait list, to accept it, but they can help a little bit. Is if a student has at least 3 sciences done at ISU, they'll get a bonus point. And then if I have a student that has reapplied from a previous year and was considered qualified the first time, the qualified mainly being they had enough prerequisites done, they had enough sciences done, and they had that minimum 2.8 GPA, then they get the bonus point. And where I have seen these make a difference is that if I have an applicant, let's say I have applicant 1 and applicant 2 at rank 5 and 6, applicant 1 may have the same GPA as applicant 2, but then applicant 1 is a little bit slightly higher because they had a bonus point. But again, it doesn't make a significant amount of difference, but it can make a small amount of difference.
Okay, great. Thank you.
Certainly.
Any
And then
other
as a quick
questions?
little, go ahead.
Any other questions from the students?
Apologies, I talk over people sometimes.
No, no worries. What do you think it makes Idaho State University's program so special?
Well, I could talk about that, but Mackenzie and Veronica, do you have anything you want to share with that?
I would love to share. I kind of mentioned it earlier. This program, like Jennifer said, has been around for a long time. And so a lot of our faculty have actually graduated from ISU and are now teaching. And so they know exactly the things that we're going through. They know exactly what we're being asked to do. And at times it feels impossible. This program feels like I'm never going to make it through. How am I ever going to see the patients I need to see? How am I going to pass all the tests I need to pass? And I think the community that's built within this program has made it to what it is. Not saying it doesn't have its difficulties, but the professors here and the instructors in the clinic are here for us, and they all come from so many different, they come from the same school, but they've all had different experiences. They all have different degrees. We have professors with masters in dental hygiene. We have one in public health. So it really just gives us a scope of so many different opportunities that we have. And they've all experienced so many different things that really allows us to see what our futures could be in different aspects and different retrospects of whatever we want to choose. And then I think also is that we, Veronica and I agree or talk about this a lot, and I think she would agree, is that we have become a very tight-knit class. And like Jennifer said, we went through COVID, we were accepted, and we didn't get to meet each other in person for almost a whole year. We would see each other in clinic, but we didn't see each other's faces until just a couple of weeks ago in the classroom. And so we have built this really close-knit community, and a lot of classes do the same thing through the years. And I don't know, you just make lifelong friends. And I've heard so many things about this program specifically because of that. So the support system is unbeatable. And then the education just is the cherry on top.
What's
And
the
then
worst
given that we
thing?
have a small class size, pardon me, Erin, I don't mean to interrupt, so that we're able to give, or the faculty are able to give more individual focus to our students. And yes, it's amazing to watch the bonding in the classes. And again, I have the unique opportunity of getting to meet the students first, because since I am the main contact for the program, everybody almost always comes through me first. And Yuritsa has been amazing because she helps me with them as well, and then send them over to me, pardon me. You know, so that's been fantastic as well. And so, you know, we do, the nice thing about ISU is that we have the resources of a large university, but we have a small town feel. And that the big thing that I'll tell students is that you're not a name, you're not a number, you're a name, you're a face. We care about your experience. You know, and for instance, my involvement with the students, I help them as they get in, and then I help them as they get out. So as they're in the program, it's very, very cool to watch them work, but I'm not going to presume to know all the hardships that they go through and the hard work that they do. But it's so cool to watch the class that I remember being that nervous group of students in orientation 2 years ago, getting ready to put on their caps and graduate and go out and get their jobs and be wonderful representatives of the profession.
So tell us, what's the worst thing about being a dental hygienist?
That's a hard one. Veronica, do you want to go first?
People hate the dentist. That's it. That's the only bad part.
I'd second that. And I also think the smell can be a little bit gross sometimes, but you get over that really fast.
Okay. What's the best part about being a dental hygienist?
Helping someone love their smile for the first time in a long time, or maybe ever.
I'd agree with that too. And then just providing them the education that they've never heard before. Just like making that difference in their life. The really cool thing that we get to do as seniors is we get to choose a patient. We keep them anonymous, but we present how their outcomes have come as we've treated them. And Veronica and I have both presented this last week in our class and a lot of our other classmates. And it's just amazing to see the changes that people have made in their lives when they come into the clinic and got the education that we wanted to provide and got the best services with everything that we offer here. So that's really special too.
Piece of advice you could give to students who are contemplating going to Idaho State University's program?
You have to learn to laugh at yourself. You have to laugh. It's easy to forget.
Sorry, Veronica. Mine would be that once you get into the program, it's not a competition anymore. Find friends, make friends, because the people that we're with for the next 2 years are the ones that are going to be there for you and that really know what's happening in your life, unlike your family members or anyone at home knows.
All right. Any other questions, comments?
So as we conclude, I just wanted to share my PowerPoint one more time with you guys so I can provide you with our contact information. So one moment, please, while I provide that up here. All right, here we go. So the nice thing is, if you look up our department phone number, it's my phone number. So you will reach me pretty easily. But I have my email address here, my pretty picture, which is on our website, and our phone number. And I am more than happy to help you. If I don't know the answer, I'll find somebody that does. And, we appreciate you guys taking time out of your day to have us come on today. And thank you. Do you guys have any questions for us at the conclusion of our presentation?